know that people with psoriasis, in addition to the emotional side of it, also have higher risks of heart disease, diabetes, obesity. So it's important that we're looking at all of those things and treating those other issues that can go along with psoriasis. So that's a big reason to care about this and make a little bit of a bigger deal about it, because it can be sort of a window to the inside and show us that there's more going on here. Psoriasis is a very common inflammatory skin condition. It's estimated to affect about 7.5 million people in the United States, or roughly 2 to 3% of the population. So many people have this, and it's important because it's a lifelong disease that can affect not only the skin, but also the joints and various internal organs, and can have very wide-ranging consequences, and so requires a lot of follow-up and treatment to manage all of those things. I think one area of potential misinformation is that it just affects the skin. And for some people, it can just affect the skin. Now, that doesn't mean that it's not necessarily debilitating, especially if it's affecting areas that are prominently seen, say the hands or the face. Other people who are interacting with an individual with psoriasis might not know what it is. They might shy away from that person, be hesitant, be worried that they're going to catch something. So knowing what it is, realizing that it's not infectious is a very important thing that we have to educate people on. Most people with psoriasis, it just shows up out of the blue. We think that for most people there's some sort of genetic component. Sometimes that can be as simple as having mom or dad with psoriasis, and you can see it coming down through the generations. Sometimes it's a little bit more subtle than that, but there are clearly other factors we don't completely understand, various environmental types of factors. So a lot of people will get psoriasis at pretty defined ages. It can really strike at any age, from birth into sort of elderly people. But there are a couple of peaks where it's more common. The late teen years, early 20s is a pretty common time to develop psoriasis, as well as the late 50s or early 60s. There are a number of different types of psoriasis. The most common is what we call plaque psoriasis, where people develop these what we call plaques on the skin. So these are areas of skin that are raised, often itchy, sometimes painful. They're red, they have a fine white scale on them. Those can appear anywhere on the body, but there are certain hot spots that tend to be the worst, in particular the scalp, elbows, knees, lower back, sometimes genital area. Sometimes a person will just have psoriasis in a couple of those areas. It will stay pretty localized, but it can affect 90% of the body plus, so it can get very severe. When we're treating psoriasis, we often think of it as a therapeutic ladder. So it means that we'll take initial steps that are not super aggressive, but also have few side effects. And if that's not sufficient, we can move up and go to more aggressive things, where we sometimes trade off a few side effects, but we want to make sure that we're getting the skin disease under control. So we'll typically start with topical medications. So these are various creams, ointments, gels, and liquids that you can put on the skin. One of our favorite very safe treatments that can treat the entire body is something called phototherapy. So it's a medical type of light treatment. People often mistake it for a tanning booth. It's a different type of light. It doesn't make you tan, and it doesn't have the dramatic increase in skin cancer we see with tanning booths. Beyond that, we start to look at what we call systemic medications, pills and injections. Most of these work in similar types of ways in that they reduce the activity of the immune system. The bottom line is, no matter the severity of the psoriasis, we have a lot of different types of treatments, so there's always hope out there. There's always something that we can try and usually find to get psoriasis under control. It's important that you work with your dermatologist to come up with an appropriate plan based on the type of psoriasis you have, the severity and where it's located. And it is really important to have these coping mechanisms. We really want to look at this from two different fronts. One is treating the actual psoriasis that's there, but the other aspect is this is a chronic disorder. And we find that people with psoriasis have a lot of the same issues that people with other chronic disorders, including heart disease, cancer, diabetes. They can all be very similar, in particular things like depression, things like alcoholism, we can find with psoriasis, just because it's a very difficult thing to deal with. So it starts with the skin, but we have to think about the entire picture. So one of the exciting things about psoriasis is that we're always getting new treatments, and that seems to be escalating recently. And there are several medications now being studied that are likely to be available soon. So there's a lot of hope out there, even for people who failed other medications. And I'd encourage anyone with psoriasis to ask their dermatologist about old and new treatment options to get the help that they need and deserve.